A piece of the COVID-19 puzzle that has yet to be addressed is why children are much less likely than adults to get infected and harmed by the disease. Not only are fewer children testing positive, but those who do are likely to have mild symptoms. However, children who have underlying conditions may still be at increased risk for severe symptoms. Nobody is spared. Children, teens, and young adults can still contract and spread the virus without showing symptoms, which means they need to take the same precautions and play their part in containing the pandemic. I'm Dr. Freddy Gomez. You're watching MedTalk Health Talk on CNN Philippines. Children can be silent spreaders of COVID-19. They need to know that they play a major role in containing this pandemic. To help us with today's discussion, let's welcome Dr. Yen Reyes. She's a pediatric infectious disease specialist and an assistant professor from the UST Faculty of Medicine and Surgery. We also have with us Dr. Pauline Convocar. She's an emergency medicine specialist and immediate past president of the Philippine College of Emergency Medicine. Thank you both for joining us on this episode today. When children get COVID-19, they're usually asymptomatic or have mild symptoms. Dr. Yen, what do we know so far about how COVID-19 affects children?
COVID-19 or coronavirus is still transmissible through children through droplet. So, if a person cough, and the problem with children less than 2 years old, they're not allowed to wear face mask and face shield, so they can easily be transmitted. So they can also be transmitted through aerosol. Like for example, if someone is nebulizing and then the virus can go to the air, it can be through airborne transmission. So in the Philippines, the Pediatric Infectious Disease Society of the Philippines made a study, and then in 100% of cases, 20% are asymptomatic, and those who are 80% symptomatic, only less than 10% are critical or severe.
Are there some factors, Dr. Yen, that you see that could lead these children to get to that point?
We divide COVID into 4. There's mild, moderate, severe, and critical. So mild, there is only cough and colds. So moderate, there is pneumonia. And severe, there is the presence of cyanosis and increase in breathing. And then critical, the patient is already in a little bit end stage, and there are already a lot of complications. So patients who went into severe are those who are immunocompromised. Like in my patients, so those who have leukemia, acute lymphocytic leukemia, they go into severe COVID. Those who have heart diseases, congenital heart diseases like VSD, and those who are cerebral palsy. I have a lot of patients who went into severe COVID, those who had cerebral palsy, and those who have kidney problems. So those who are in immunocompromised conditions, especially in children, they go into severe or critical most of the time.
There's what is called a multi-system inflammatory syndrome in children, or what is commonly known as MISC, which is a serious condition that is linked to COVID-19. Dr. Yen, let's explain this condition to the parents who are listening, and what is its effect on children?
MIS A for adults, MIS C for children. So for children, MIS C, there are criteria 5. Number 1, there should be 2 organ systems involved. Like for example, the lungs or the heart are involved, so more than 2 organ systems. There should be a proper diagnosis that it was really diagnosed to have COVID. Number 3, it's 21 years old. Number 4, there are inflammatory markers positive.
Could you explain, Dr. Yen, some of the symptoms commonly seen with those with MISC or MIS-C?
So in patients with MIS-C, usually 2 organ systems are involved. Most of the time, the primary involvement is the lungs. The patient usually have difficulty of breathing. Some have cyanosis. Some have this suprasternal and intercostal retractions, and some have gruntings. So with that, if there are 2 organs already involved, means the lungs or the brain, when they have decreased sensorium already, that's 2 organs, it is already labeled as MIS-C.
Maybe children who might appear in the ER, they might have redness of the face, or merong mga namamagang hands or feet or stuff like that. Could this be a sign na meron na silang inflammatory syndrome?
We always think of any particular inflammatory syndromes na which may be from a wide range of diseases. And of course, first in our mind, in our current pandemic is COVID. And we have to also watch out for some of the red flags because when they're brought to the emergency departments, almost always, we don't know yet what's the history, and we have to really rule out or perform some diagnostics and perform really assessment on what may have caused that inflammatory syndrome, which may of course be MISC.
The B117 or the UK variant is associated with increased virus transmissibility. This means it's more efficient and more contagious. Now, concern is growing that kids contract this variant more easily. Dr. Pauline, is there any truth to this?
Yeah, you have to understand that, of course, when we're seeing family clusters, if there's an increase in infection in the population, there's really chances of mutation. And so we have these variants. And unfortunately, the B1117 or the UK variant is really accounted for the high transmissibility in our current surge. So it is indeed true, and we're seeing this in our emergency departments that there's already family clustering, and of course, children are not spared when we have family clustering.
Could this be also a factor for a child to have critical to severe symptoms? Kumbaga, nag-elevate yung symptoms niya from mild with being infected with a variant.
Yes, it's possible. What is good in children is that children are less susceptible to COVID. Number one, they have less exposure because the children are usually stay home, and if there's someone who's COVID, that person will stay out of the children. Number two, there is the COVID goes to the hit of the COVID is the ACE, angiotensin converting enzyme, and that they noted that it is decreased in children and more in adults. And also the cytokine is higher in adults than in children. So the children has less cytokine, so they are less prone to cytokine storm or the severity of the COVID disease. And also children, especially those who are less than 5 years old, already have the disease of corona. They usually have recurrent cough and colds, and some of them are already infected with a lot of respiratory viruses or even the other serotypes of coronavirus. So they have because of competition, it's less likely that the coronavirus will also have to compete with other coronavirus in the epithelial cells. However, since the UK variant are more transmissible, we still have to see what will this variant take effect to the children.
The World Health Organization warns that the Indian variant could be even more contagious than most versions of COVID-19. The country now has more than a dozen confirmed cases of this variant, which is earlier described as a double mutant. Now, Dr. Pauline, what do we know so far about this variant?
It was initially discovered in India, and it also accounted for the current situation in India. So we also know that there's really high transmissibility as an effect of the mutation. But I just have to say a little bit of a caveat that we may not just attribute the high transmissibility only purely to the variant, but also to human behavior. So it's really multifactorial, but definitely the variant really has an influence on the current increase in the numbers.
Will the symptoms of these variants be distinguished from one another? Meaning, malalaman ba ng isang parent na nahawa ng anak niya ng UK variant or ng Indian variant, or pare-pareho ang mga simptomas na makikita nila?
Most of the time, based on studies, the symptoms of COVID are really cough and cold. So in worldwide, in 40 to 60% of cases, usually cough and colds. So even if the patient is affected with any kind of variant, just as long as it is coronavirus, it is usually the same symptoms. Some also have sore throat. A lot of patients have sore throat, even in children. And diarrhea is also a common manifestation. I even had a 3-month-old with fever and diarrhea, and the patient was COVID. So in my patients who are teenagers, they usually complain of anosmia, as in loss of smell, and ageusia, loss of taste.
COVID-19 vaccines are our shot at a hope to end this pandemic. But which ones are safe for children? We'll have the answers after a short break. Our mission is for better health for you and your loved ones. Here on MedTalk Health Talk, only on CNN Philippines. Does COVID-19 affect children differently compared to adults? This is MedTalk Health Talk on CNN Philippines, your partner in healthcare. I'm Dr. Freddy Gomez. The most common symptom of COVID-19 in children are fever and cough. Very general nga naman ito. Dr. Yen, what can you advise the parents of children when it comes to their fear of the variants out there and if their children might be caught with one or not?
Okay, so this is a very general advice. So if your child has cough and colds, especially if it is associated with sore throat, diarrhea, anosmia, or aguesha, it is really best that you should consult a doctor.
What are the most concerning symptoms naman that parents should watch out for when they're taking care of their child that show some signs of COVID-19?
The most common presenting complaint for emergent cases already in the emergency department is the difficulty in breathing. For pediatric cases, we have to also account that there may be other symptoms on top of the confusion, inability to stay awake, discoloration of the fingers that may already be signs of poor perfusion or circulation, which may be a sign of a shock. And of course, for those patients who are now unable to have really poor appetite or are unable to drink or eat, so these may be signs of conditions that we now have to bring our patients to the emergency department. So these are what we call red flags.
Now, initially, children weren't included in the trials for COVID-19 vaccines. Dr. Yen, what's the reason behind this? Does this concern more of the safety of the vaccine or dahil masyado bang bago itong vaccine kaya hindi pa tinest sa mga bata noon?
Okay, so children are initially not included in the trials of COVID vaccine because they are not the population at risk. So worldwide, the most common persons involved, affected with COVID are the adults. So usually the working age group, and there is great mortality in elderly. So they started it first with adults.
The Centers for Disease Control, or CDC, recommends that children 12 and up should get vaccinated. Dr. Yen, what vaccines are currently safe for children right now?
For example, the Pfizer vaccine first had their study for 18 years and above, and they are already recommended for 18 years and above. Then they already have a study wherein they are granted the emergency use authorization for children 12 years and above. So children 12 years and above can already avail of the vaccine, and it is already approved in the United States, and just recently Singapore also declared that they are already approving the vaccination, COVID vaccination for children 12 years and above.
Now, prevention is the best way parents can keep their children safe from the virus, which means social distancing, observing health protocols, and just in general, keeping their immune system strong. And speaking about health protocols, wearing masks is essential to avoid contracting COVID-19, according to the World Health Organization. Now, children aged 5 years and under shouldn't be required to wear masks. Dr. Pauline, are there situations where they should be wearing masks?
Definitely 2 years and below should not be allowed to wear masks with regards, because there are barriers or there may be difficulty breathing for that particular age group. But for inevitable circumstances when you need to bring the patient or the child out of the family's comfort of their homes, then it is advisable that these children should wear masks. So they may be in public transportation, when you bring your children for medical consults, or when it's inevitable that you have other guests at home and they may be inadvertently exposed to outside your bubble, so outside your usual family members, then it may be unavoidable that these children should wear the necessary masks for them to be protected.
Dr. Pauline, what's your advice for parents who bring their kids out to play sports, doing physical activities with regards to wearing a mask? What's your advice for them?
It is really a balance between being able to still be physically active and be protected or isolating yourself from the rest of the world to protect yourself from COVID. So it's really a balance that all parents and all family members should consider. So there are still restrictions as to allowing children to go out of their homes and only when necessary. So there may be alternative activities inside the homes. It will be for the best interest also of the families when exposure is really limited or avoided.
It starts with the parents on determining whether bringing out their children into public is really warranted. So only those instances where it is absolutely needed. Now, keeping your children healthy is as important as teaching them preventive measures. More on this when we come back on Med Talk Health Talk only on CNN Philippines. We're your connection to healthcare. Stay with us. Welcome back to the show. I'm Dr. Freddy Gomez. You're watching Med Talk Health Talk on CNN Philippines, and we're committed to making communities healthier, especially in this time of COVID-19. Routine child visits to the doctor and immunizations are essential, even more so during this pandemic. Dr. Yen, let's explain why.
So it is really very important to update the immunization status, especially during this pandemic. So what is very important is the kids should have their flu shot because especially flu, the manifestation is fever, cough, and colds, and it is almost the same as COVID. So if your patient has fever and cough and colds and you need to go to the emergency room or the hospital, you will be placed in a COVID area. So you have to eliminate other causes of fever, cough, and colds. You need to have your child's flu vaccination or flu shot. Another is the measles vaccination. So we have a lot of cases of measles. We had an outbreak of measles 2019, and we have an increasing cases of measles up to now. I even have a patient who still have measles because the mother was afraid to have their child vaccinated. So a lot of complications of measles can also happen, and patients can also die secondary to measles. And it can be prevented. You just have to go to your doctor and have your measles vaccination. Another one also is the polio vaccination. So since polio is also free and the government has a project to even go house to house for polio vaccination, please avail the polio vaccination. So this is high time for me also para manawagan to all the mothers and to moms and dads to bring your child to complete their vaccination even during this pandemic. Because as pediatricians, we also assure you that your child is safe while we vaccinate them.
But Dr. Yen, what if in-person visits aren't possible? For one reason or another, what's the alternative for the parents, for their child?
Okay, since the pandemic, I already started with telemedicine. So a lot of my patients, I just tell them the instructions. They can go to free platforms like the HIP, Natra, HIP Natra. They can Google it. They just sign in and then you will look for a doctor.
Now, another way to keep children healthy during the pandemic is by teaching them preventive actions. Dr. Pauline, what else can parents do to keep their children healthy?
It's very good that we have to have very open communication with the children. So children also deserve the right information. And of course, definitely, ultimate nito talaga is to be good role models as well to the children because they follow what the adults do. So also, with simple reassurance for all of their fears, their anxieties, they may have countless of questions, but we have to also give them a sense of control in these very uncertain times.
Dr. Pauline, how can you help them stay physically active while keeping themselves safe from the virus?
Yeah, giving them alternative activities and being with family may also we may also develop family-oriented activities, and these may not be limited really to being outside of the families. So you may have certain activities while confined in the homes, or you may just visit family members within your bubble or within your the history of exposure of such families on your compound perhaps, and it's also not that bad if you also expose our children to areas where there's good ventilation. So if indeed you have to go out, we do alfresco dining, making sure that apat dapat will be followed. So this is for air ventilation, maintaining the physical distancing, to always wear the face mask and face shield, and always limit the time of exposure to less than 15 minutes.
Very good advice. And with that, I'd like to thank our guests for today, Pediatric Infectious Disease Specialist Dr. Yen Reyes and Emergency Medicine Specialist Dr. Pauline Convocar. We appreciate your time. It was very good to have both of you on the show. COVID-19 does not spare anyone, and that includes children. But while it's good to know that most children who catch the virus get very few of any of the symptoms, it doesn't mean they cannot spread it to other people, especially the vulnerable adults. It's best that children are made aware that they need to behave like everyone else, and that means to instill the importance of proper hygiene and health protocols. Let's remind them why they need to wash their hands regularly, keep a safe distance from others, and wearing a mask, which is key. I'm Dr. Freddy Gomez. Your health is our mission on the program. Thank you for watching MedTalk Health Talk on CNN Philippines.